structures here. So does anyone know the names of this red structure going downwards? Okay, perfect. So that's going to be your right coronary artery, and your right coronary artery is going to come off your aortic, your right aortic sinus. Okay, so it's basically coming off your ascending aorta. It's just the first branch that comes off the ascending aorta, and that gives rise to right coronary artery. So you've got the right coronary artery there, and you can follow it down, and you can see that it's very much going down the side of the heart. Then it gives off this branch there, which is called your right marginal branch of the right coronary artery. Okay, so that's quite important. So then, as it goes underneath here, you've got your posterior interventricular branch of the right coronary artery. So essentially you've got right coronary artery going down, then right marginal branch of the right coronary artery, and then you've got your right interventricular artery, otherwise known as your posterior interventricular branch. Okay, so those are the main points really of the right coronary artery. If we were to block this right coronary artery in this region, what kind of myocardial infarction would occur? Okay, so it's going to be your anterior STEMI. Okay, yeah, because you're looking at it from the anterior surface. So the right coronary artery is going to be supplying your anterior surface of the heart. However, if the right coronary artery was blocked down this region here, what kind of myocardial infarction would that cause? Okay, well, perfect. So that could cause your inferior myocardial infarction. Okay, so inferior below or anterior in the front. If we look at the other side, so if we come down this region, and you can see just through this gap here is this structure. This is your left coronary artery. Okay, so maybe if I remove this, it'll be a little clearer. Okay, so yeah, you can see the left coronary artery is going to be coming off your ascending aorta as well. And what the left coronary artery does is it splits. So initially it gives off this circumflex branch. Okay, so the circumflex branch comes down this way. And then down this way is your left anterior descending branch. So sometimes called your LAD, okay, or other times called your anterior interventricular branch. So these are important because essentially if you were to block your circumflex branch, what kind of myocardial infarction, heart attack would you have? Okay, so you would have a lateral myocardial infarction. So if you think this is the anterior view, so lateral is going to be on the side. Yeah, so this is your lateral side. So that's your circumflex branch of your left coronary artery. What if we were to block off our LAD or anterior interventricular branch of left coronary artery? Well, you would get a septal myocardial infarction. So the reason that is because this area here down on the bottom, so where your apex is usually referred to, is called your septal area. Okay, this is why you've got septal branches essentially being given off in this region. So septal region, so LAD is going to be your septal myocardial infarction. And sometimes you can have a combination. So you can have anterior septal if just so you've blocked your right coronary artery and you've also blocked your LAD. So it really depends on the clinical picture, essentially. So that's pretty much the main key points that they will expect you to know about the heart. So hopefully that was somewhat useful, and if you have any feedback, I'd love to hear it. And thank you very much, and good luck for your exams. Thank you.
Like this video and smash that subscribe button as well, and make sure that you hit the bell button and get the notifications for the new videos in the future.